Okay, so the BiPAP unit we're going to talk about is the V60. This is the unit you will see on your floor the most. So the first thing we're going to talk about is the mask. All the masks come with the headgear, and there's a white clip that clips at the bottom of the mask. So anytime you have a patient that needs to have sips or take pills, whenever you go to give those, just undo the snaps and then lift the mask up on its hinge. Then when you're done, put it back down and reattach the clips. We don't want you to do the Velcro because we fit the mask to the patient. So if you undo the Velcro, you have to refit it after you take it off. So clip and lift. The second thing we will talk about is the unit itself. So the first thing that a lot of people ask about is how to put the unit into standby. So on the touch screen on the bottom right hand side is the standby button. If you tap that, give it a few seconds, the machine should kick into standby like it just did. Sometimes it will not kick into standby unless you actually disconnect the mask from the circuit. So if you have a machine and you hit standby and it continues to cycle, just take the mask off. If that doesn't work, you can power the machine down. Simply hit the power button down here on the bottom right and then tap ventilator shutdown. So with the V60, after you shut it down, when you turn it back on, the same settings will populate on the screen, so nothing will be changed. Another question is to tell what your patient is on, what settings they're on, what mode. So on the V60s, there's this little gray bar above the blue box, and it says active modes. So this one is currently in a CPAP mode. So it says active mode CPAP. Also, the only settings you'll have is a pressure setting. So it says CPAP here with a 12, and then your FiO2, which is at 50%. So if you have a doctor that asks you what your patient's on, you can look at the machine, you see that it's a mode of CPAP. The CPAP is a pressure of 12 and 50% FiO2. One of the other modes you'll see the most is BiPAP, which on here is called ST, which stands for spontaneous time. Same thing, the gray bar, it says active mode ST. And then you have different settings. Your first one is your IPAP, which is your inspiratory pressure. You have your EPAP, which is your expiratory pressure, and your FiO2, and a backup rate. So if the doctor asks what your patient is on, you give them the settings as I over E, so IPAP over EPAP. So 15/8, oxygen's 50%, and their backup respiratory rate is 15. So that's how you tell the mode and the settings on the V60. Alarms. So one of the arms you'll see the alarms, you will see the most is the patient disconnect, low minute ventilation, low tidal volume. All of those alarms indicate that there's something disconnected somewhere. So the first thing you want to do is start with the patient. You're going to check that the mask is fitted on their face. You're going to check that the circuit is not disconnected. And then you're going to check all your tubing to make sure everything is plugged in and closed. Of course, you can call your RT, but these are some troubleshooting things you can do until they get there. So patients that are on BiPAP or CPAP have a leak on their mask. So that number is right here. It says total leak 109. We like to see that number under 100. You don't want it to be 0. If it's 0, the mask is too tight and you'll have skin breakdown. Another thing, we have skin protection for our masks. These are called the protective gels. They're clear jellies. I'm not going to open it because they're expensive. But they're clear jellies that go on the skin under the mask. They can be washed with soap and water and then let them air dry so you can reuse them over and over again for the same patient. So if you take one off, don't throw it away. We need it to put on the patient again that night, the next day. For continuous BiPAP users, their diet should be NPO. If the physician has not ordered NPO, do not be afraid to call them and tell them to order NPO. If they do eat, they need to stay off the machine for at least 30 minutes to an hour so they don't get air in their stomach and vomit and aspirate. If they're in restraints, you need to make sure you have a sitter in the room, someone who can remove the mask for them if they were to get sick. And then also they need to be on tele with pulse ox so we can monitor their SpO2 while they're on the unit. And if you have any questions, call your RT. Charge phone to 7320, and every day we fax out a sheet with who your therapist is and their phone number for the day.